Hi, I'm here with one of our patients from Infinity Wellness Center, Kendall. My name is Dr. Tanisha Wards, and we're going to talk a little bit about the topic of skin. Skin, I think, is, especially for women, but I think for everybody, such an important part of our confidence and how we feel about ourselves. And um, we often think, putting something topically on it will fix it, but really we find that Infinity Wellness Center, it's really healing it from the inside out is what we need to do with it. And our skin tells us something. Our skin kind of tells us what's going on the inside of the body. So we're going to dive into all of that today. So first of all, thank you, Kendall, for your time. I really appreciate you meeting with us.
Of course. Thank you for having me.
Yeah. So tell me, how did you find Infinity Wellness Center?
Yeah, so it is kind of a funny story. I'm a student at the University of Texas at Austin. I'm a journalism student. And we were writing for one of my classes, we were writing a health and wellness story or health and fitness story. And I wanted to do something about gut health. It is really popular currently. And it's just something that I've always been interested in. I love just overall nutrition and health in general, and I love what food can do for your body. And so I was reaching out to different doctors, practitioners, dietitians, just to kind of find someone to interview. And I reached out to Infinity Wellness Center after just looking y'all up online. I actually reached out to you, Dr. Wards, at first, but we couldn't find a time to meet that worked. So you referred me to Dr. Sanchez. And so I interviewed her. And during our conversation, she was kind of explaining how, gut health can also cause skin problems like acne and everything like that. And so after I kind of talked to her about that, I was thinking, because I had recently been experiencing just really bad breakouts, really bad acne breakouts, and they were like, I didn't know why. Because I'm someone who's typically had like pretty clear skin. But all of a sudden I was just getting these like really aggressive breakouts. And so I was thinking about it. And I, kind of like you said, I think that acne is a sign of something deeper that's happening in the body. I truly believe that. And I didn't want to go and see a dermatologist or like a quote unquote traditional doctor for it, because I didn't want to be just prescribed medication, because I really believe that there was something deeper happening, and I didn't want to just mask it with whatever medication, topical treatment they were going to give me, because that's kind of just like putting a band-aid on a bullet wound. It's not going to fix anything. And so after thinking about it, I was like, I would really like to pursue this um, and go with y'all. And I thought like the way that it worked out, because I was initially supposed to interview you, but then I ended up interviewing Dr. Sanchez, which is who I'm working with right now. I just feel like it was the universe pointing me towards this direction. Like I truly believe it was like, here you go. This is your answer. This is where you need to be. So
Totally. And what you don't know is all of us there's 3 doctors at Infinity Wellness Center, and we all have kind of our passion or our favorite stuff to work with. And hers is skin. She loves to work with skin stuff and gut. And she's plant-based and vegan. Not all of her patients are, but like those are her kind of 3 things. So if somebody called with skin issues, we would say, oh yeah, Dr. Sanchez loves that. We can all do it. And we all do it. We all see it in our practice, but that's just like one of her favorite things to work with. So it absolutely was the universe saying, you're in the right hands here. So that was great. And it's such a cool story that, yeah, you called to interview her, but then you're like, hey, I should be a patient. So when you came in the first visit, we do a lot of things a little differently. We do kind of a timeline history. Was there anything in that history that was significant for you? Did you pull out any other symptoms that maybe you didn't think were related, or any past issues or health issues? Kind of tell me about the first experience of your first visit.
yeah, so I feel like I've always been pretty like generally healthy. And I had always like eaten really healthy too. And I haven't had like any real like sicknesses or anything in the past, but I did have, like, while we were going through my history, so my history was kind of boring, not gonna lie.
That's a good thing. That is a good thing. Sometimes the history, like I'm looking at the time and I'm like, we're gonna go over an hour here, and sometimes that happens. So that's a good thing.
Yeah, there was, so yeah, it was pretty boring, but I did, like, my first year of college. I had a really awful year. I did not like the school I was at. I was too far away from home. I'm a homebody. I'm very introverted. And so I had a really, really bad first year of college, where, I was just stressed all the time. I don't think I was eating enough. I
Mm,
lost my period, like,
mm.
completely. It came back a few months after I came home, but, like, there was, like, a really good chunk of time, like a few months where I was without a period, for, like, the majority of a year. So that was a really stressful time, and I think we also just highlighted that, like, I'm a very stressed out person,
Mhm.
um, partially from school, and then also just because I kind of do it to myself. I think I didn't really realize it before, until, like, we were talking in, like, conversations I've had with my family members, and they're always like, "Yeah, like, you're always stressed out," and I'm like, "Am I? Like, I'm just like this," and I didn't, like, really notice that, like, it was kind of a big deal, like, how stressed I was. So yeah.
Yeah,
Um,
not to get too off topic, but I would say most high achievers are kind of like workaholics, stress a little, and that takes a toll on our bodies. It takes a toll on our adrenal glands, on our hormones, all of it. The other thing is, going away to college, especially in an environment you're not happy in, that's a trauma.
mhm,
I tell people all the time, the body, you don't have to be actually chased by a lion or a tiger for the body to think it's in fight or flight. You don't have to have bullets, you know, being shot at you to really feel like you're in a trauma. Those things could be more like micro traumas, and the body reacts the same. It's pumping out adrenaline and cortisol, and it does use up a lot of the good bacteria and reserves in the gut lining to make more cortisol to keep you upright. So all of that could have contributed, absolutely. And yeah, it's all stress, and it's all relative to what you're going through at the time. That how the body doesn't know if you're training for a marathon, which is a good stress, or you're running from a tiger, or
mhm,
you're having financial problems, or a death in the family. It just all reacts the same way, and so absolutely that can disrupt the hormones and the whole issue, and absolutely be a culprit of acne for sure, and gut issues.
mhm.
So what were your major symptoms when you came in, if you were just to list a couple?
Yeah, so definitely, like, just being stressed all the time. I was really moody.
Mm,
I have, yeah, and this kind of came up in some of my results, but, like, she was telling me, Dr. Sanchez was saying, like, sometimes if there's a problem with the liver, like, each organ in your body kind of deals with, like, a different feeling, or it reflects in
mhm.
that. And so
An emotion, yeah.
an emotion, thank you. And so I was feeling a lot of, like, anger and irritability. And so she said, like, there could potentially be, something up with my liver. There was. Um, so that was definitely a symptom. Uh, Constipation, bloating, not so much the constipation anymore. That was really when I had that really awful year of school, where, yeah, I, like, was super constipated all the time. I could not go to the bathroom. Then, yeah, the acne for sure. And then I didn't really notice that there was anything wrong with my period. Because initially I thought that, like, what I had was a gut issue.
Mhm.
Um, and I mean, I'm sure we'll talk about it later, but we kind of ruled that out. So I didn't, but she did ask me because she thought, like, something might be up with my hormones. So she asked me to start tracking my period. And so ever since I started doing that, I was like there was some weird things happening. And so that I didn't notice before because I just thought it was normal. So
Interesting. Good. Yeah, I love that's something I love about our history and our first visits. We are looking at the whole body, right? We're not just like, okay, you have skin, here's how you treat that. Like, what layers are causing the skin issue, or all of them, right, with the gut. And yeah, I love that. That's looked at in Chinese medicine, but a couple different places also is connecting emotions to organs.
mhm,
And yep, liver is anger, gallbladder is resentment. We're the only one of the only countries, maybe the only country in the world that doesn't connect mind and body. Like, we have two separate doctors and two separate systems for that, and it's not disconnected. So that's good. One thing we do with our patients that I think is a little different than a lot of other clinics is we rate the symptoms each visit. And one thing I love about that is patients look back and they're like, oh my gosh, that's where I started. When you came in with the skin issues on a scale 1 to 10, 10 being the worst, 10 meaning it either affects my daily activities or it bothers me enough. Again, talking about skin and especially women, right? Like that can really bother us. Where would you have rated your acne when you first came in?
I think it was probably like around a 7. I'm always like really hesitant to use the bigger numbers just
I
because
know.
like
Because
I
you're like, I'm
have to
not in
save
bed,
them.
right? I'm not
Yeah.
debilitated.
Yeah.
But it's all relative to you, right? Like if you're like, hey, I don't want to date because my skin looks bad, that's a 9 or 10. Or, if I'm dealing with it every day and I'm spending hundreds of dollars on, medication or ointments or lotions or facials that aren't working, that could be a 9 or a 10 too. So I tell people that's a tough one. I know it's hard to say, right? You're like, I'm not dying. It's not a 10, but there's no wrong answer. Yeah. So 7, I think, is a good number that like, hey, it's visible.
Yeah, it was, yeah. So then I guess maybe like, yeah, probably like an 8 or 9. It was really bad. And yeah, I didn't want to leave, like, I didn't want to leave my house without like makeup on. This was kind of the good thing about having to wear masks everywhere is if I didn't want to put makeup on, I could have a mask on to cover my face because I didn't want people
Yeah.
to see it. Yeah, so it was pretty bad.
So that affects your whole life. Yeah. And it looks beautiful now, by the way. Your skin, I mean, from the video, it looks flawless.
I have
Talk.
makeup on, so
Okay. Oh, got it. Okay.
I just went to an interview for something, so
What would you rate the last time you were in was just recently? What did you rate your skin issues at then?
I put it at I put it at a 1.
Excellent. Great.
Mainly because like I didn't so I have really bad hyperpigmentation right now.
Okay.
So it's still like very visible on my face, but I've been reading it as like active acne, and if that's like bothering me or being like, I don't know, if I'm having like a flare up, and I really had very like minimal, like barely anything active, and even if I did have something active, it wasn't surfacing.
Yeah. Good. Yeah. No, that's still much better. And sometimes hyperpigmentation can be liver too. So
Mhm.
that may be worth digging back in with her too.
Mhm.
So yeah, from a 7, 8 to a 1, what treatments did you go through? Like,
Yeah,
did
so
she address hormones, liver, gut? Yeah, kind of walk me through that.
yeah, we kind of did like a process of elimination, I would say, and kind of addressed it all. So we started with the gut,
Mhm.
and we kind of ruled that out. I was doing an anti-inflammatory diet and other supplementing, and that didn't really help too much. Like my skin was not happy. And then we did candida, which
Mm-hmm.
that definitely helped a little bit. I definitely had probably like a little candida overgrowth. And so after doing that diet and stuff like that calmed my skin down a good deal. We were in the process, like kind of around then. I was supposed to start doing a hormone panel,
Uh-huh.
but like the month that she gave it to me to do, I didn't get a period.
Mm.
And so this was like I had been tracking my period and and I don't really have like bad period symptoms either. Um, like I maybe get a headache, but I don't really get cramps or anything. So we were just kind of tracking that, and it was like my period length was looking a little irregular, but once I totally missed one when I was supposed to be doing my hormone panel, which is like a saliva sample, throughout the entire cycle. Once I missed that, so I went like 60 days without a period.
Mm.
And my next one, I went 25 days before, like, so it was just like, that was really weird. And so I couldn't do my hormone panel. And then I started it when I got my period again, but then I had been doing like a prolonged cycle or something. And then it ended up being 25 days. So I had to pour them out in circles.
Oh, yeah, 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 yeah.
Yeah. So that just took forever. And I did a blood work test.
Mm-hmm.
And so after we kind of ruled out, yeah, like it's not gut, it's not it candida helped. It's not really a nutrition problem because I've been eating fine. And I always kind of had been, so it didn't seem like there was a food reaction to anything. Then we kind of like through the blood work and the hormone panel, we narrowed it down to it's a hormonal issue.
Yep.
And I can talk about that if you want, but
yeah, no, that's helpful. I think that we don't have to go into like what your levels look like or anything, but yeah, definitely. So with hormones, I know what we do is we bring in what you're missing, or try to really get your body to make what you may not have enough of, and that could start in the pituitary of the brain all the way down to the ovaries, getting the right organs making the hormones properly. And then if you have too much of a hormone, which too much testosterone can cause acne, too much estrogen, then we do detoxing, and all of that ties in with the liver too. So yeah, is that kind of what the route she took with it?
Yeah, sorry, I forgot. We are doing like liver kind of taking some supplements for that. So yeah.
And the beautiful thing about that is once we do all that and we get the organs working properly and balanced, and we, get rid of toxicities, the body should be able to maintain hormone balance on itself by itself. That's the goal, right? Is that you're not needing to come in and fix this every couple months. However, life happens, stressful things happen, food, diet changes, life changes. So sometimes things can get out of balance again, but our goal is to, detox the liver so the liver can break down the hormones properly, rebuild the adrenals, thyroid, pituitary, so they can communicate to the ovaries properly. And so, yeah, it sounds like that's exactly what she's doing now. So perfect. Awesome. Well, this is super helpful. Any other thoughts or last minute kind of just, I guess, advice for somebody if they're dealing with skin stuff, of how to look at it or what to do next, or what, just what your thoughts are? And I love that you did a piece on that. I would love to read the article that you wrote. If you ever feel like sending it over, I'd love to read it. But yeah, any thoughts or last minute advice for anybody?
Yeah.
Going through something similar.
I definitely would say, like, everybody has their own beliefs about, what's the right way for them to go, like health wise. But I do firmly believe like acne is a symptom. It's not like an illness or an ailment or whatever. It's a symptom of something deeper that's happening in the body. And everybody deserves to feel confident in their skin. Everyone deserves to feel good about themselves. And like, especially with acne, that can be like, it's something, I don't know, it's something that, in society, like we all kind of are just like, ooh, like, I don't know, it's not a pretty thing. It's not.
Yeah.
And so it kind of does. Yeah. So if you are looking for help, get it. I mean, do what's best for you. I know that functional medicine, it can be more expensive, but it has definitely been worth it. And working with Dr. Sanchez has definitely like changed my life. It's really nice to have someone who actually cares about you and like listens to what you're going through, and she wants to help. So yeah, I'm just like, I'm still on this journey, but I've been enjoying it so far, and I'm just looking forward to, just keep going. So
awesome. I couldn't have said that better myself. You're right. Acne absolutely is a symptom. And until you figure it out and uncover it, you're going to keep having it, right? You can't mask it. So yeah, I couldn't have said that better myself, and I didn't prep you to say that, right? For the audience, like you get it. And you're right. Everybody has their own belief in health and medicine, right? And with functional medicine, once I think it clicks and people get it, they're like, oh, we're doing it all wrong in a lot of Western traditional medicine models. And once it clicks, you're like, I can't go back. I could never take something to band-aid a symptom now, because we got to fix what's going on, or this is just going to keep happening. Yeah. And I think that's perfect. That sums it up. Well, again, thank you so much for your time. I remember what it was like to be a busy college student. So I'm really thankful that we were able to get on the calendar so quick. And I know this interview is going to help other people as well.
Of course. Yeah, I'm happy to do it. You guys have done so much for me, so I'm happy to help even just a little bit.
Awesome. Thanks.
Thank you.